So external review means a review that's completed by an independent review organization or an IRO, or sometimes it's called an independent review entity or IRE, that is external to the payer's internal appeal process. So the internal appeal process is sending your appeal back to the payer, whatever levels of appeal they allow you, 1 or 2 or 4 or 5 or whatever. External means you're sending your appeal to an organization that is not the payer. And then the patient rights of appeal. So patients have much greater rights of appeal than providers do. And you can use this to your advantage. So we get asked about that quite a bit. How do I appeal on behalf of the patient so that I can take my appeal to external review when I use the patient's rights of appeal? Because a lot of external review is really governed by your state regulations. There's a little bit of federal regulation in there as well. It's primarily state regulated. And patients in every state have the right to appeal to an external review organization. Rarely do they do it. Rarely do they use that, probably because they don't really know about it. Or very few patients appeal anyway. But to take it to external review, I think it's more of a knowledge thing than anything else, at least from my research on it. But providers can appeal on behalf of the patient, and that allows you then to go to external review. Why do you want to go there? Well, historically, and from reports that we've seen, you have a better chance to overturn if you can get outside of the internal appeal process, if you can get to an external independent review organization. So that's what we're talking about when I say going all the way, taking your appeal all the way. That means advocating the patient's greater rights of appeal for the hospital's benefit. As long as it gets overturned, you're going to get paid as a provider.